Welcome to this group of lectures on routes of drug administration. This is the first of these lectures, and I intend to introduce the subsequent lectures. In this introductory lecture, I shall classify the routes of drug administration. I will define some key terminologies, and lastly, I will give an outline of subsequent lectures. So, what is a route of drug administration? It is basically the means by which a drug is introduced into the body. So we shall now classify the routes of drug administration. As you can see over here, all routes of drug administration are classified into two broad categories, namely the systemic routes and the topical routes. What do we mean by systemic? Systemic routes are those whereby a drug is given so that it can be absorbed into the body and distributed into all body organs for a systemic effect. So here, the intention is for the drug to be absorbed for a systemic effect. Now let's look at topical routes. Here, the intention is that the drug should not be absorbed. Rather, the drug is given for a localized effect at the site of administration. Now let's look at the systemic routes. They are further subdivided into two, namely the parenteral routes and the enteral. So we need to define the key terms that I had previously mentioned. Remember, I stated that topical routes include external application for a local effect. Now we shall look at the two systemic routes. We said we have enteral. So enteral routes include those whereby the drug is introduced to the body through the gastrointestinal tract. For instance, you can give the drug rectally into the rectum, or you could give the drug into the buccal cavity, or the patient may swallow the drug. The parenteral tracts include all routes whereby the drug is introduced into the body through other organs other than the GIT or the gastrointestinal intestinal tract. For instance, a patient can receive an intramuscular injection whereby the drug is introduced directly into the muscle. Here, I have listed the most commonly used routes of drug administration, and these are oral, intravenous, intramuscular, subcutaneous, and topically on the skin. We will look at each of these in more detail. Now, I will give a very brief overview of what shall be covered in the subsequent lectures. We shall first start with the topical routes of drug administration, followed by the enteral route, and lastly, the parenteral route. For each route, we shall look at examples, advantages, disadvantages, and what affects absorption from that route. Thank you, and I trust that you shall have an enjoyable time.